This conference will now be recorded.
All right, good morning, everyone, and thank you for joining. As Lizanne mentioned, if you go ahead and mute your mic, put your name and organization in the chat box by way of welcome and introductions. And then we'll move on to old business. So Lizanne sent out the December 2020 meeting notes. Hopefully everyone had a chance to review them. Are there any corrections to those minutes? Okay. With none being said, then we'll go ahead and accept those minutes as they're written. Our executive leadership report, the executive leadership team met last week to discuss the budget. We also discussed some new opportunities for CGIC that Lizanne will probably mention in her director's report. We do have an executive leadership meeting convening tomorrow to go over some more issues. And with that, I will turn it over to Lizanne for presentations.
Thank you very much, Tammy.
You spell your name wrong. Oh my God.
Excuse me. Hi, everybody. If you could mute your line for us, thank you. So, Tammy, I'm going to ask you, because I know you're busy today with that. Do you have? I'm going to put you at the top of the agenda for the moment. So, because I know that you're running today. Could you give us a quick update on the vaccine?
Sure. So we are actively working in Tier 1A+ right now in Chatham County. So that includes healthcare workers, first responders, long-term care facility residents, their staff, and anyone over 65 plus their caregivers. We're doing that daily at both our health departments in Chatham County, in Savannah. There are other partner agencies that are also offering COVID vaccines. If anyone needed a list of those, they are on the Coastal Health District website, which Lizanne can send out, but it is gachd.org. We are doing anywhere from, depending on the day, 500 to 1,200 vaccines daily. At the health department, on Mondays and Thursdays, we have started ceasing all of our other services and doing only COVID-19 vaccinations. So that has helped us, to get more vaccines out there. Right now, we have a good supply of vaccine in Chatham County. I anticipate that we'll be in the Tier 1A+ for a while yet, but I don't think we'll move on to Tier 1B for a while yet. But we are still looking to work with some other community partners to see if we can branch out and do some even more vaccinations, do some off-site clinics. We've partnered with Hospice Savannah. They've done some events out at Gulfstream where they did like 500 last week. We partnered with J.C. Lewis. They've gone out into the community and helped us with vaccinations. So that is our primary focus right now, is getting the vaccine out there. And we're still doing some services at the health department, but they are just essential services at this point. Does anyone have any questions? All right, thank you.
Thank you, Tammy. So we're going to move ahead with our agenda. First up on our presentations is a group of folks from Step Up Savannah. So I'm going to turn it over to Alicia Johnson, and we'll learn more about a new initiative that they're working on. Thank you, Alicia.
Hi, Lizanne. Hi, everyone. Good morning. Thank you so much for having us this morning. I believe that Rachel has the PowerPoint slides, or Kimberly can share her screen now. So one of the things that Step Up Savannah is working to do is to reframe our work to a asset building community development model. And what this does is take a look across our communities to find ways to use our existing resources differently or compound solutioning for that. And one of the most striking things that I think that requires is us looking at the poverty narrative and making sure that not only are we following the data, but that we're using research and best practices to inform our work. And one of the things that we found in taking a look at our community is around asset poverty. And I know we hear that term, the term poverty a lot. And so we've come to take it to mean, a variety of things that are, intrinsic maybe to our agency or our work. But about 25% of the US is asset poor. And asset poverty essentially is having insufficient net worth. That this includes durable assets such as home, car, savings, business, being unbanked to cover 3 months of expenses without income. And here, the pandemic did nothing but magnify the level and nature of asset poverty in our community. In Savannah, we have about 36% of our families living in asset poverty. That's a tremendous amount. Again, when you think about the fact that we are trending higher than national averages and across the U.S. And when you look at our households, over 30% of our households of color have zero net worth. And that's a startling fact to think about. And what we're doing, again, is looking at our programs to figure out ways where the safety net is geared to really intervene in that tyranny of the moment when folks are without food or without medical assistance and they're meeting that direct, immediate, emergent need. But what can we do as a community to start building a little bit of scaffolding across our safety net so that the safety net, again, acts for that tyranny of the moment, but there are ways that we have in structures, programming, and things that we can do in our community to help them move away from the tyranny of the moment and intervene in this cycle of poverty. So one of the things that we've expanded our public benefits program so that it's more community facing. We've partnered with REACH to make sure that we're dialing down in those about 10 to 15 census tracts in our community that have these high asset poverty rates. And one of the things that we have found is that we have a lot of people in our community who are in what we would call the benefit cliff, or they don't make enough to support themselves. They don't have enough money coming in, but they make maybe too much to be able to qualify for some subsidizing. So we're taking a look at what can we do as a network, as a community, and what are some of the best practices that are occurring across our nation that we could possibly bring here. So we've created a task force, and I'm going to let Kimberly and Harley tell you about the work going forward and some of the things that the task force will be working on.
Yes, thank you so much, Alicia, for that introduction. To illustrate the PopUp benefits cliff a little bit more, we're going to start with a video And then we'll go into some more details.
What do you think of when you think of the American dream? It means different things for different people, but for Leah, a 25-year-old single mother of two working a low-wage job at a theater concession stand, that dream is to become a nurse, an opportunity occupation in her hometown, offering a salary higher than the median wage. Becoming a nurse could also place Leah on a path with options for professional advancement and help her provide a better life for herself and her family. As Leah starts her journey, costs like educational fees and higher taxes on pay can actually cause a dip in her income. But over time, Leah's future looks brighter. After taxes, her lifetime earnings are higher. That's part of the American dream, right? Unfortunately, Leah's situation isn't this simple. Like many workers earning low wages, Leah receives public assistance to pay for food, medical care, child care, and housing. As Leah's income grows, she'll lose access to those benefits. Often, this occurs before she makes enough money to cover her full expenses herself. An entire decade could pass before Leah begins to break even. And as a result, for most of her children's lives, Leah's standard of living will actually be lower. This forces Leah to choose between her children's best interests and her own brighter future. Financial barriers like these can be so daunting. Some people in Leah's situation will give up on their dreams or experience too many barriers to achieve them. This devastating combination of increased pay and the resulting loss of support is called the benefits cliff, and it's a significant obstacle for workers seeking a better life. And make no mistake about it, while Leah is depicted here as an animated character, her story is based on real-life challenges faced by many Americans. As a taxpayer, Leah's situation also impacts you. If Leah could move from her current job to becoming a nurse, the combination of her increased tax contributions and a reduction in her taxpayer-funded support could recover hundreds of thousands of taxpayer dollars over the course of her lifetime. Employers, educators, nonprofits, policymakers, and others could work together on solutions that provide opportunities and pathways, pairing people like Leah with businesses in need of skilled talent, while allowing Leah to work toward financial security for herself and her family. Informed by sound research and thoughtful policy, the right partners could create a win-win situation, empowering Americans like Leah to avoid the perils of the benefits, saving taxpayers money, and increasing the odds Leah, her children, and the rest of us can make all of our American dreams come true.
So essentially, when a family lacks the savings and assets and the things they need for any type of economic emergency, like the one we're in, such as losing a job, having an unexpected expense like a hospital bill, a flat tire, or having a prescription cost without insurance, a car repair, they're more likely to cause serious and lasting hardship for them, even if the family has enough income to cover very bare minimum basic expenses. And so we want to actively engage our community and our safety net in program planning to address some of the needs of our families here. And that'll include surveying, focus groups, and much more. And I'll let Kim and Harley talk to you about that.
Sorry about that. Yes, thank you, Alicia. Okay, I'm going to turn it over to Harley to talk about more specifics surrounding the public benefits cliff. Get it.
Okay, thank you both so much for sort of framing this for us. And I'm just going to continue that a little bit. Can everyone hear me well?
Yes, we can hear you.
Okay, so thinking about the public benefits, you really want to frame it. And so we laid this out for everyone. So thinking about who experiences the public benefits, this is sort of twofold. So you have individuals who are already receiving public assistance, who are offered a chance at financial growth or just economic opportunity. However, they're sort of faced with this ultimatum between taking the job, taking the raise, and getting, say, like $1 increase in wages, and then losing their public assistance. And so it's important to realize that, you know, that dollar wage isn't necessarily going to guarantee them self-sufficiency. And so they really have to choose between keeping their public assistance and losing that. And so the federal poverty limit, they would then exceed that. And so they really have to choose. And it's not a situation of, you know, individuals being lazy or not wanting to work. This is more of a situation of survival that individuals have to choose between. And so you also have individuals who are ineligible for public assistance because they're technically over the federal poverty threshold. And so these individuals don't receive public assistance. However, they don't actually have the means and resources to be self-sufficient. And so they fall in this gap or in this public benefits cliff as well. So thinking about why the public benefits cliff occurs, there are sort of two reasons for this. So you have policy pitfalls, because the current policy doesn't consider the actual cost of living, and so it perpetuates poverty by ignoring the reality that individuals face. And so I know that in eligibility requirements, you have a very limited scope of what they include. So, you know, you'll have like your telephone, but they don't have a very comprehensive understanding of all of the expenses that individuals have. And so there's also this lack of transitional benefits under the current status quo. So again, there's this ultimatum: you either are under the poverty threshold and you're in poverty, or you're over it and, you know, you're not in poverty. And that just isn't realistic or reflective. The system is currently like two dichotomous. And so related to that are the rigid requirements and eligibility requirements. So, you know, there are things like work requirements, there are asset limits, which I know for TANF is $1,000 for individuals. And then again, that limited scope of actual expenses. And so the second reason that the cliff occurs is that there's a lack of access for individuals to services that bridge the gap between public assistance and self-sufficiency while folks are on the road to economic mobility. And so sometimes there aren't enough resources, or individuals aren't connected to the resources in their communities that can help them, you know, with food assistance, education, childcare, and utility assistance, which we know are vital for, you know, just maintaining at least. And so oftentimes you even have services that have the same sort of requirements as public assistance. So those income-based eligibility requirements, and that just reinforces the sort of system again and puts individuals in a situation where they're just stuck. And it doesn't, again, take into consideration individuals' bills versus their income. And so some consequences of this are that individuals avoid economic promotion because they fear losing those very valuable resources such as food, healthcare, childcare, and things of that nature. And so the system sort of encourages and perpetuates generational poverty, because if the parents aren't able to achieve self-sufficiency, they just get stuck in this sort of trap that is encouraged by the sort of status quo. And so, you know, their children fall into that as well. And so just thinking about the amount of spending that goes into public assistance through the federal government already and state governments, you would expect to see a move in the federal poverty rates, or poverty rates at all don't. So there's sort of a negative correlation between the numbers and the dollars spent and the prevalence of poverty. And so that alone would call for some sort of reassessment in the policy. And so this sort of frames our work and why we incepted the task force. And this is really, you know, just that local level service provider perspective. So how can we
Amy Brown say that on Mondays and Thursdays at both their locations, they do all-day COVID, only all-day COVID vaccines. And she said that they do have a good supply, that they partner.
Everybody please mute themselves. Thank you.
Okay, sorry about that. So, so this just frames our work and what we're doing at the local level to help individuals experiencing this lift. And so with that, I will turn it over to Ms. Kim, and she'll outline what it is exactly that we're doing.
Yes, thank you so much, Harley. So talk about a little bit about what Step Up Savannah is doing. We have started a task force to work on bridging the public benefits cliff. And our vision is to collaborate local services, programs, and agencies to increase economic mobility, reduce poverty, and sustain self-sufficiency for those experiencing the public benefits cliff. Some of the goals include encouraging economic mobility through assessing needs, implementing direct service from service providers, expanding community partnerships, and advocating for policy change. And so I'm going to go through these just a little bit. So to assess the needs, we're working on surveys and focus groups, and this will include working with both those experiencing and at risk of experiencing the cliff, as well as service providers. And then after the needs assessments, we're going to determine, design, and implement direct service programming, working with those that are on the cliff. Some of the ideas that we're working on are creating new support avenues such as food distribution, like maybe gift cards, or partnering with grocery stores, maybe doing like a matching program. We also are thinking through doing maybe a Facebook support group that would connect directly to the Step Up page, and that we could offer support, share resources. Community agencies would also be able to post on this page as well, and we're working on the guidelines for that already. And essentially our direct service goal is to provide quality services to small groups of individuals, thus empowering those individuals to then help other individuals. So just the whole idea of quality over quantity, and working on supporting one family at a time out of this cliff. So we're also going to evaluate needs and advocate for policy via the survey. So we're going to make some recommendations to key policy voices in our community, including like different task forces and just like our connections with various folks locally and statewide. We have current collaboration. So our current collaboration involves those who are in our task force. Some of these folks include current public benefits assistance providers, such as Savannah Technical College, St. Mary's, Moses Jackson Advancement Center, Wesley Community Center. We have legal folks at DBPI, folks from CGIC and Georgia Legal. We have Gateway Behavioral folks, Healthy Savannah, and more. And we also have those that are actually experiencing the cliff or at risk of experiencing cliff on the task force as well, so that we can get from those. We meet bi-weekly. One meeting is task oriented, where we work on specific tasks. We might form breakout rooms, and then the other is just information sharing. Again, like the current projects are the surveys and focus groups, for distribution, and Facebook support group. And then future projects that we're thinking through are doing maybe a peer-led support group, whether that be virtual or in person. Again, policy initiatives. And then we're researching and hopefully starting the conversation with folks at the Federal Reserve Bank of Atlanta to hopefully get the career ladder identifier and financial forecaster to come to Savannah. And this will essentially take some of the uncertainty out of what it'll take to excel in one. It gives like snapshots of what it'll look like, what they need to budget, what their budget will look like if they got rid of all their public benefits. So it's a great tool to use, and we're hoping to bring that here to Savannah. There's only like one or two other folks in the state of Georgia using it, and it's up near Atlanta. So we're hoping to bring that here to Savannah. So the last thing is just how can your agency help? So the first thing is that you can join the task force and assist in the development of this work. We're still very much in the planning stages. If you're interested, you can contact me, and I will connect you to the task force for sure. You can also help with surveys and focus groups. This information will be coming soon. And you can help complete the surveys with the clients. You can complete the service provider surveys. You can attend focus groups and just help promote the client needs assessments. And then lastly, we're always looking for recommendations and ideas. If you see something that we're doing that you may not agree with, or you have like fresh and new ideas, please, please, please contact us. We're very much in the development of this work. And if there's any resource or funding opportunities or anything that you think that would support this group, please email us that information. And in closing, here is our contact information. You can email us at any of these email addresses or contact us at the number below. And I have shared this presentation with Rachel, and she can certainly share the information with you guys.
Does anyone have any questions for the Step Up team or comments? So there are, Alicia, there are, and Kimberly, and I see Harley has just responded. There's several comments in the chat feature. So
Okay.
please make sure you see those, and I think there's some opportunities to follow up with different folks in the coalition. So thank you so much. That was fantastic. Lots of great information and lots of opportunities for us to work collectively. With that, I'm going to turn it over to Reggie and Peter to talk about the new oral health initiative.
Okay, thank you, Lizanne. Good morning, everyone. We're just excited about the opportunity to share information this morning with the group outlining our recommendations from the Planning Council's oral health initiatives. My colleague, Peter Roberts, who co-chaired our committee, and Dr. Randy Ford, who's chairing our adult free dental event, will also present information today. As many of you may know or recall, the Planning Council is a county-wide planning body of key stakeholders, including providers, government representatives, advocates, and academic representatives. The goal of the Planning Council is to strengthen the healthcare infrastructure for oral, primary, and behavioral health care, and building capacity within our community safety net system, thus improving access to affordable care. In 2020, the Planning Council convened a group of stakeholders who wanted to better understand the oral health needs of Chatham County residents. As part of our oral health initiative, in partnership with Georgia Southern University's College for Health Professions, a needs assessment was conducted with approximately 600 Chatham County residents. Rachel, go to page 2. Thank you. We compared our needs assessment results to a needs assessment completed by the CDC's National Center for Health Statistics. We found that 56% of Chatham County residents had seen a dentist in the past 12 months, compared to 65% in the CDC survey. 22% of adults 65 and older had lost all their teeth, compared to 15% from the CDC assessment. 72% of adults in Chatham County reported having no dental insurance, and 11% of adults in Chatham County reported treatment from local ERs for dental pain. Rachel, page 3. The main issues from our needs assessment were not really surprising. We found that the respondents indicated that poor oral health negatively impacted their mental health, employability, and self-esteem. It was also reported that populations at risk due to other disparities are negatively impacted by poor oral health. We also found that dental health has become, unfortunately, devalued due to separation, oftentimes from primary medical care. We also found that cost continues to prevent many Chatham County residents from accessing regular professional dental care. And then finally, lack of insurance coverage prevents access to dental services by many adults. Rachel, page 4. Page 4, have provided additional data also from the needs assessment. As you can see, 76% of the people responded would like to see a dentist more frequently, especially for preventive services. 68% did not seek proper dental care as a result of high costs, and that came across crystal clear in our needs assessment. 72% of the report, 72% people reported not having any or adequate dental insurance. And 11%, as we said earlier, use hospital emergency room for dental care. 24% reported the need for dentures, while 89% would use free or low-cost services. And what was interesting is 38% of the respondents reported that they would only use free services because of the challenges that they had financially. Peter Roberts will take over again. Peter co-chaired our committee, and he'll pick up with our presentation.
Thank you very much, Reggie. I appreciate the opportunity to be here today. This is obviously a long-standing and very significant issue for all of us in Chatham County and Savannah. And I'm pleased that our task force has come up with a series of recommendations, and most importantly, we're in the process of implementing them in 2021. But we need the help of everyone. There are no simple solutions to adult oral health, and it's going to take the efforts of every single one of us over multiple years, but we can do it. The first goal is to increase access to free oral health and eliminate the disparities. Now, some of you may wonder, don't we already have low-cost dental services in the Savannah area? And yes, we do. But as Reggie indicated, because of cost sharing and sliding fee schedules, those are still unaffordable for a very significant portion of our population. So there is a hole in the system, and many adults, as you saw from Reggie's statistics, are not getting regular dental care. And obviously that has an impact on not only their dental health, but their medical health, and then finally their employability. So it actually impacts the economics of our community and the employability of adults. The first goal is a tripartite goal and is in the process of being implemented. First of all, we are going to hold an annual free adult public dental event here in Savannah, the first of which will be in the end of August of this year. And in just a minute, Dr. Randall Ford is going to share the details about that. The second is we are building a provider network of independent private practice dentists in the area to offer free dental services in their office through a administrative referral process. So many dentists already provide pro bono services in their offices. We are formalizing this process into a network, and we'll be able to service not everybody, but at least some portion of those in need. And then third is a fixed dental site. We have determined it is feasible, and we have built a business plan for an adult dental clinic supported by philanthropy and a volunteer staff. And I'll tell you more about that in a minute. Next slide, Rich. The second goal is focused on partnering with all of you. The educational process and the referral process are going to be extremely important, and we want to embed them in all of your organizations and activities. So we will be coming to you and talking to you about how we might work together in the future. And the second way is, how do we partner with youth organizations and youth in the community to create what I call first generation change makers? Maureen McFadden already kicked us off and got us off to a good start with the Teenish podcast and our first youth focus group. There is interest, obviously capability, but we think that one of the best ways to influence the behavior of adults is through their family. And so we're excited to be able to empower the youth in our communities to help the adults in their family improve their oral health habits, behaviors. Next slide. The third goal is we will be obviously creating a brand, developing a public relations campaign, and then trying to use trusted individuals in the community as oral health champions. This is a very critical part of our work, is going to be getting the community as a whole to appreciate the priority of oral health and the primacy of it. Next slide. Integrating oral health and primary care. Clearly, one impacts and affects the other very much. Therefore, we will be training and using volunteer dental navigators to connect dental patients with their medical providers, their behavioral health providers, and social service providers. As we all know, many people in a population have needs in all these areas, and they often don't know where to go or how to get services. So the process of case management or navigation will be critical. I would now like to turn it over, next slide, Rachel. I'd like to turn it over to Dr. Randall Ford. Go ahead to the next slide, thank you. Who will share with us the free pop-up dental clinic. Randy?
Thank you, Peter. I would like to, can I be heard? Is everybody hearing me okay? Peter, shake your head yes if you can hear me, please. Perfect, thank you. Thank you. I'm privileged to work with Reggie and Peter. They're very, very sharp folks, and they do a great job with this. I was recruited out of Georgia Southern. I've practiced dentistry for 30 years, and I've actually worked with remote area medical in Tennessee. And that is a group that we decided to partner with when we decided that we needed to do a free clinic. We looked at several groups that do this around the country, and remote area medical made the most sense. It's a cost-effective program, so it's easier on the community and on us as an organization, so it will allow us to be able to do it more. We're actually looking at the 28th and 29th of August to put on a program, and we plan on serving 300 patients in a very COVID safe environment. The way that remote area medical and their volunteers work today is very different than 2 years ago when I was volunteering with them up in Tennessee. And Reggie and I had the privilege of visiting a clinic this fall, and I looked at what they did and I felt very, very safe. I felt like it would be a good thing to bring down here, and they meet and exceed CDC guidelines on that. We're looking to hope to have about 25 dental operatories that are set up in surgical suites, and typically we'll run about 20 of those for dentists and about 5 of them, and about 5 of them for dental hygienists to clean teeth, and we'll be providing cleanings, restorations such as fillings, and extractions. Those will basically be the 3 services that we provide. And we will probably have about 50 volunteers. And I noticed we have 59 people here, so I know 3 of us will be volunteering. So if the rest of you volunteer, we'll have everybody we need. We'll be looking for some nurses to help us with triage. We'll be looking for people to do administrative work. We'll be looking for dentists and dental assistants and dental hygienists. So if you know anyone that meets any of those categories, we would love to have you contact us. Reggie, is there anything I've left out that you'd like me to bring up?
No, Dr. Ford. Thank you very much.
Okay. Are there any questions that anybody would like to ask real quickly?
Oh, let me add, and I'm not sure if we said this, but the free dental event is for adults 18 and over, and there is no charge for the services that are provided. Additionally, we're partnering with Georgia Southern's Communication Disorder College, and they will be providing oral health cancer screenings as well.
Thank you, Reggie.
Peter?
Okay, Rachel, you can flip to the 2 slides ahead. Next one. Okay, thank you very much. No, if you could flip back 1 slide on the free dental clinic. Thank you. So we are going to be working on kicking off a free adult dental clinic in Savannah and Chatham County. As many of you know, the Planning Council does not own nor sponsor any clinical care delivery activities. So Sister Pat Baber from St. Joe's Candler and I have been having discussions with a number of nonprofits in the local area, and we are finalizing a partnership right now with Savannah Volunteer Dental Clinic for Children. This is an organization that many of you know was founded by Dr. Felix Maher and other pediatric dentists 12 years ago. So that organization is going to sponsor the adult free dental clinic so that we can move ahead. It provides a variety of preventative and restorative services, and then of course evaluating other health concerns and referrals to the FQHCs and other specialized providers for specialized services. The care management process is extremely important so that we provide a holistic approach to each of our patients. Rachel, you can start to flip through the last few slides, and you can just continue to show each one. These are some opportunities for volunteering that we wanted to share with you. As Randy and Reggie said, obviously we need help. This is going to take our whole community, and there are lots of ways to get involved, or you may know of other people who would like to get involved. And if you could have people just contact Reggie, the executive director of the Planning Council, for more information, that would be great. Thank you for the opportunity today. It's been a joy to work on this as a community volunteer, and I am so excited, as is Randy and Reggie, about what we are kicking off. Thank you very much. Reggie,
you.
did you want to say anything else or hold questions?
One more thing, just based on some of the comments in the chat room. Again, thank you, Peter and Dr. Ford. I certainly could not have done this work without you and the wonderful committee that we had. We have initially set the site for our event with the Civic Center. Unfortunately, with everything going on with COVID, we are being bumped from the Civic Center. So we are currently talking with 3 or 4 different venues for the possibility of using their facilities. We're still open. If any of you know of a large facility, we need parking for about 100 cars, and a large type gymnasium type area is what we can utilize for our event. So we hope to finalize our venue in the next 7 to 10 days. We have to have the venue secured before remote area medical can come down to do a site visit and basically confirm that our space is sufficient. And then we will start to aggressively advertise our event. We will also put it on the RAM website. They will also be recruiting dentists and professionals who have traditionally followed their organizations to various sites around the country. So we hope to be able to certainly get back with you soon about the site. But again, we are, as Peter indicated, there are multiple opportunities for you, your friends, your family to become involved in this important initiative in Savannah. And Liz Ann, we thank you again for allowing us this time.
Reggie,
yes.
in case somebody on here has a site in mind, we're looking for a space of approximately 5,000 square feet.
Okay, thank you. Okay, thank you.
Any other questions, comments for Reggie or Peter or Dr. Ford?
I have a quick question. Will there be flyers and preferably PDF versions so we can get the word out about this once it's up and going?
Yes, we do have extensive materials that's been developed, but again, we're holding off on that distribution until we can actually nail down the site.
And I do have a question as well, Lizanne, from Mr. Reginald. If you know any community members who would be in need of these services, who do we refer them to? You directly, or?
You mean in terms of the for the clinic program, for the
yes.
free, for the standalone clinic? Is that your question?
So say if someone needed services like tomorrow, or are there any options available to them now?
Yeah, basically the 2 FQHCs, J.C. Lewis and Curtis V. Cooper, would be options currently for any dental care that a person would need. As Peter indicated, one of the things that we're doing as part of the initiative, Dr. Ann Linton and Dr. Natalie Vermouth, they are coordinating and leading an effort to develop the free referral program through local dentists. But again, all of that is currently in the works. But anyone needing care should and have limited resources or no insurance should be referred to the FQHC, either J.C. Lewis or Curtis.
Okay, thank you.
And Reggie, please forgive me if I missed this part. Once, because I'm trying to monitor the chat and you know, do crazy things all at the same time. So is there once you finalize the date, when would you think you would start making appointments for those 2 dates? What in a sort of the time frame for that?
Once RAM, remote area medical, comes down to do the site visit and approves the site, then we will start to initiate the reservation process for appointments.
Okay.
So it's hard to say now. It's really going to depend on us nailing down a site, and then the appointments will be available. They can be booked online. But again, we will certainly keep everyone apprised. We'll get a list of all the participants here today and make sure that you are updated as we move forward.
And then I think just adding on to that, one consideration will be, especially for the population of people who may need it the most and may not have access to the ability to sign up online. Just thinking about how this group and many of the organizations who are represented could help with that part of it. Once we
and we've thought about that too, Liz Ann. There'll be a way to call in to leave information, and we can get people registered.
Great.
I think our group's done a good job of anticipating needs and certainly recognizing that everybody does not have access to a computer or a smartphone. We'll have multiple ways that they can get registered for that event.
Awesome. I was just calling out the groups on this that are represented here can help with that as well.
Yeah, we would appreciate that.
Yeah. Thank you so much. Any other questions for Reggie or Peter or Dr. Ford? Thank you so much. That was very informative, and I would be remiss if I also didn't mention the correlation between dental health and heart health. Is a big correlation between those two pieces. If there's plaque on our teeth, sometimes there's plaque in our near or lead the veins around our heart and arteries. So I would just say, during our heart month to think about those two things and to keep our heart healthy. So thank you, Peter and Dr. Ford and Reggie, for that great information. Rachel, if you could pull up the agenda, the second slide, we're getting into the project team updates and upcoming meetings section. So these are the project team updates that we have. You'll see that this is sort of a consent agenda. If there are members of either the economy, education, health, or quality of life team that would like to call out any particular pieces of these, if you would unmute yourself to do that. Otherwise, we'll move along into the agenda. Okay, so we'll leave that as a consent piece. On your agenda, if you would go back up to the first part, Rachel, you'll see the next dates for these upcoming team meetings for economy, education, health, and quality of life. If you would like to be added, if you're not currently serving on one of these teams and you would like to be added to that team, if you would please let us know that, and we'll be happy to add you on to one of the teams, because that's kind of where the rubber meets the road and where we get a lot of work done. So we would welcome you to be a part of one of those teams. We're now moving into new business. So I would like to open the floor up for anyone who's on the call who would like to give a partner highlight. If you're talking, I can't hear you.
Suzanne, can you hear me?
I can.
Wonderful. Good morning, friends. This is Maureen McFadden with Gateway Community Service Board. And I just wanted to highlight, I've spoken about this at the Health Subcommittee, but I wanted to let everyone know for the larger CGIC group that Gateway has received funding through DBHDD for what we're calling our Strive Clinic. And that provides us with the ability to serve individuals who are 16 years old to 30 years old who are experiencing their first break with reality, their first psychosis is what it's called. And so what we are able to provide them is the team is comprised of a lead clinician, a psychiatrist, a supportive employment specialist, another licensed clinician who can provide family therapy. We also have a certified peer specialist who has lived experience and a case manager on the team. And we can work with them for up to a year and really help, set them up so that and work with them so that they will never experience, hopefully, another psychotic break. That's the goal. And that they will be invested in their recovery and be able to manage it with the support of their family and support from the community. So we've started that process, and we've already worked with our first 12, 13 individuals, and we can take up to 30 at a time. So we're very excited. We've been getting the majority of our referrals from our Behavioral Health Crisis Center. We've also received one from Juvenile Court and another from Chandler Hospital. So we're just excited that we have the opportunity to serve this very important population, and I just wanted everybody to know about it. So thank you, Lizanne.
Thank you, Maureen. No other updates? Yes?
I was just going to say, people may not realize they have to hit *6 to unmute themselves, because I didn't realize that.
Okay. If you're on a call and you want to.
Oh, hi, this is Patsy Prager. Yeah, I'm with the Georgia Southern University Department of Public and Nonprofit Studies in the Master's in Public Administration program. That's a mouthful. I just wanted to let you know that in the fall, we have a concentration in public and nonprofit studies, and our nonprofit studies program will be located on the Armstrong campus. So we're looking to make connections coming up to broaden the nonprofit concentration for the MPA program. We believe that being in Savannah will be a benefit for the nonprofit concentration. So more on that later, but I just thought I would put that out on your radar right now.
Thank you, Patsy.
Wanted to introduce myself. Can you hear me?
I can.
Okay. I missed the beginning of the call. I apologize. I was on another one. My name's Emily Burnside. I'm calling in from Memorial Health University. I'm the new Injury Prevention and Disaster Manager Coordinator. As you know, we are the Level 1 Trauma Unit over here, and I took Sarah Kerrigan's place. I think a lot of you worked with her. My job is to assess the traumas that come into our trauma unit, use that data, and then go out into the community to educate. And our top 3 mechanisms of injury right now are motor vehicle crashes, elderly falls, and gunshot wounds. So if any of you do any education with any of those, I would love to work with you. I'm going to put my email in the chat box, and you can reach out to me. I see a few familiar faces. I see Lindsay from Beyond the Bell. I've talked to her some. My background is in public health, and I just switched over, but I want to work with you more and make sure we keep our community safe. Unfortunately, we've had a huge increase here at Memorial in alcohol-related accidents, actually a 67% increase just in this past year of motor vehicle accidents related to alcohol. So I'm trying to work with that here in Savannah. But I just wanted to say hello and introduce myself, and I'll leave my email for you.
Thank you.
Nice to meet you all.
Emily, it's great meeting you. Thanks for coming today. I've seen a couple of new faces that I don't quite recognize. If you're new to the coalition, if you would unmute yourself and introduce yourself, we'd love to meet you.
Hi, my name is everyone. Oh, well, I guess there's a couple of us talking at once. I'm Leah Hunter. I actually work with Marie McFadden. I'm the clinical team lead for the STRIPE program that she was talking about. So I'm just happy to be here as part of that. Thank you.
Nice to meet you, Leah.
Good morning. I'm Rena Dowse. I'm with J.C. Lewis Health Center, the new Chief Executive Officer. My previous role, I served as the Chief Operations Officer. I've been with the agency for over 21 years. My background is in nursing. I'm a family nurse practitioner by trade, and also serve in an administrative role as well. So I'm happy to be a part of the team. And I look forward to working with each and every one of you.
Dr. Dowse, we're so glad that you're with us this morning. It's a pleasure meeting you. I've been wanting to meet you. So I'm sure there'll be a lot of people that will be back in touch with you to get further. Thank you for coming this morning.
Mm-hmm.
Anyone else new or have a partner update?
My name is Ashley Range. I'm coming from Coastal Heritage Society, and I'm now working at Healthy Savannah as their new Director of Fund Development and Communications.
Nice to meet you, Ashley. Anyone else? Going once? Okay.
My name's Kelly Osborne. I'm an intern with the Mediation Center currently, and my intern supervisor actually connected me with this video chat today. So I'm really excited to learn about some of the resources that Savannah has. I didn't know that most of these were here, so I'm really glad I'm here.
Thank you, Kelly. This is how we make it all work together, by coming together. So we're glad you're here. So I wanted to introduce two folks that are working with CGIC. They are undergraduate interns and with Georgia Southern University, and we're glad to have them. One is Logan Bishop. And Logan, where are you?
Oh, sorry, I was muted. But hi guys, I'm Logan Bishop. Yeah, I'm really excited to be working with CGIC for my internship. I'm a senior public health major at Georgia Southern, and yep.
Glad you're here, Logan. And the other person is Lewis Shealy. Lewis, where are you?
Good morning, everybody. Sorry I can't use my webcam because the space ran out, but I'm excited to be in the meeting, and it's been good to hear from everyone and what you guys' organizations have going on.
Lewis is going to be working also with Safety Net Planning Council. We're kind of sharing Lewis and giving him some experience in mental health, so we appreciate that opportunity through the Planning Council. I wanted to give you guys a quick director's update. One of the pieces that we're working on very diligently within each of the teams is updating the blueprint document. The blueprint is just over 5 years old. So we're due for updating that document. We're adding some new strategies to the document in each of the priority areas: education, economy, health, and quality of life. And also adding in and addressing community resilience and equity. We know that the data that we'll be reporting on in 2020 will look markedly different probably from the data that we had in this last status report from 2019. And we know that it's important for us to address community resilience and what might be needed to add into the blueprint, and also to address equity issues in our community. We're in the second year. We received the additional funding from the Resilient Georgia and the Patulik Foundation funding for year 2. That funding is meant to address trauma in our community, to create trauma-informed and trauma-responsive practices, and also to look at how we can reduce adverse childhood experiences in our community. Resilient Georgia is an organization that we featured in the latest newsletter. There's a link to their website in the newsletter. If you don't know about them and you're an organization that wants to have an impact on adverse childhood experiences or becoming more trauma responsive, that certainly is a place where you can collect a lot of information. Probably our next meeting will have a report from our group that works on that project. That includes Gateway, the Planning Council, Loop It Up Savannah, and the school system and CGIC are working on several different projects together on that grant. We're continuing, CGIC is continuing to work on the organization of the behavioral health unit with the Savannah Police Department. In that particular grant, it's through September 2021. We know that the funding has been extended by the city through the end of 2021, and we expect that they will continue to fund the behavioral health unit. By the end of January, that unit had served 74 individuals in our community who have either a mental health diagnosis or substance abuse disorder. And I'm so encouraged by the work that the unit is doing, and we know that we're making a big difference in the community and connecting individuals with the services that they need sooner rather than later. So we're continuing to collect data on that so that we can continue to have those services. We're also working to disaggregate data in our community. We're working specifically with the REAL Task Force to disaggregate data in the community so that we can call out race and equity disparities that exist. We're continuing to work with the REACH grant on their evaluation plan, and fairly soon we'll be working with the City of Savannah on a Smart Cities project. So that's what CGIC's been up to, in addition to all of the meetings that we host. We are glad to have you at our table, and if there are questions or comments that you have or anything else that you would like to bring before the coalition, please do so now. Any questions for me? I would,
Hi,
yes.
I'm sorry, I missed the opportunity earlier to introduce myself, but I'm Harley Stevens. I'm the intern with Step Up Savannah right now. I'm working closely with the public benefits manager, but my passion is in public policy, specifically policy analysis. But I'm happy to be here and to connect with all of you, and hopefully we'll be seeing some of you soon in connection with us at Step Up Savannah.
Thank you, Harley.
And just to interrupt, Harley is a Georgia Southern student and an excellent public policy student at that.
Great. Thank you.
Thank you so much.
Nice to meet you, Harley.
You too.
Okay. Anything else for the good of the order? Okay, so before... Sure.
Sorry. What did you say was the name of the mental health services that you were just talking about?
The behavioral health unit, is that what you're referring to? So that if you go to the Savannah PD website, Savannah Police Department website, and type in, or either just Google Savannah Police Department Behavioral Health Unit, you'll see that come up. It is 2 officers who ride Monday through Friday from 10 a.m. to 6 p.m. and they respond to mental and substance abuse calls in our community. And 2 days a week, they have a licensed clinician who rides with them to follow up on individuals in our community who are in need of services. So you can find lots of information there. Any other questions? Before we close, I would ask that if you are a member of the health team, I'm going to ask you to stay on the line for just 5 more minutes. So if you are a member of the CGIC health team, if you would stay on. That's the end of our meeting. I want to thank everyone again for coming and being a part of our coalition. The strength of the coalition is you, and we are so grateful for you. So have a great day and a great rest of the week. Thank you so much.